Hello, my name is Dana Crawford, and I'm the PGY1 Community Pharmacy Resident at Medicine Mart Pharmacy in West Columbia, South Carolina. My project was looking at pandemic preparedness among community pharmacists in South Carolina. For disclosure purposes, I was the recipient of an APHA Foundation incentive grant, which was used to help fund this project, as well as was my co-investigator, Carrie Lynch. All other co-investigators have nothing to disclose. Patients see their pharmacist 1.5 to 10 times more frequently than they see their primary care providers, which makes pharmacists some of the most easily accessible healthcare providers. This is especially important during emergent situations like COVID-19, where we continue to offer patient care but also work to battle the situation and provide novel care. This was also seen during the 2009 H1N1 pandemic when community pharmacists assisted in creating national guidance for state officials so that community pharmacies could partner vaccination sites for H1N1. With that being said, vaccine recommendations and administration are pandemic efforts that can be fulfilled by pharmacists, as we've seen with the COVID-19 vaccines. Pharmacists can work with public health to ensure patients are cared for during these emergent situations, and state public health programs are willing to work with pharmacies, but there are significant gaps in the planning process and a lack of needed formalized relationships, which brings us to the objectives of this project. The primary objective was to determine the current pandemic preparedness, which included knowledge, adherence to guidelines, and willingness to participate in outbreak response efforts among South Carolina community pharmacists. The secondary objective was to identify pharmacy and pharmacist factors that contributed to pandemic preparedness and willingness to participate. This was a descriptive cross-sectional survey embedded within a larger survey that was created in Qualtrics and included 88 question items within 3 main blocks. One of these blocks entailed the contents of this specific survey and included 3 main domains, which looked at participant demographics, baseline pandemic knowledge, and pandemic practice. It included free response, multiple choice, and select all that apply type questions. It was pre-tested among a sample of 5 pharmacists, was distributed to community pharmacies across South Carolina, with a collection period of surveys between December 2020 and April 2021. This participation included actively practicing community pharmacists in charge, or PICs, in South Carolina. PICs' names and addresses were received from the South Carolina Board of Pharmacy on a master list, and then custom postcards were mailed to the PICs. Each postcard contained a QR link to the survey, and each pharmacist had a unique 3-digit code so that we could monitor which pharmacists had completed the surveys. Surveys were then reviewed weekly during the collection period, and additional recruitment was initiated in January and included reminder postcards and telephone calls. Each participant received a $10 Amazon gift card and were placed in a drawing for one of 5 $50 Amazon gift cards. Of the 769 postcards that were mailed, 74 surveys were completed. This low response rate is due to several factors, including duplicate pharmacist information on the master list. Because this was a master list, it included all pharmacists in South Carolina, not just community pharmacists. Some pharmacists reported not receiving a postcard, and others said they did not have time to complete the survey. De-identified data were analyzed using the IBM Statistical Package for Social Science, or SPSS. Non-free response questions were summarized by descriptive statistics, and free response questions were qualitatively analyzed with themes reported in the results. Here we have the overall baseline characteristics. Of note, about 69% of respondents listed having a PharmD as their highest level of pharmacy training. More than 50% of respondents worked in a single or multi-store independent pharmacy, and there was a mean age of about 42 years old, and the respondents had been practicing for a mean of about 17 years as a pharmacist. Moving into the primary objective, to assess pharmacists' current pandemic knowledge, respondents were asked knowledge-based questions regarding pandemics and CDC recommendations for COVID-19. It was found that 95% of the respondents answered correctly when defining a pandemic. 93% of respondents correctly identified CDC recommendations for pharmacy guidance, but only 80% of respondents were able to correctly define close contact to an infected person per CDC definition, which is within 6 feet for at least 15 minutes. This data also revealed that about 63% of pharmacists had no epidemic or pandemic education in pharmacy school, and 23% were unsure if they did. To assess adherence to guidelines, respondents were asked to list PPE or personal protective equipment available for staff and for patients to purchase, which you can see here. It included surgical cloth and N95 masks, gloves, thermometers, face shields, disinfectants, and hand sanitizers. And the respondents were also asked to describe patient safety measures, which included requiring masks, utilizing drive-through and curbside pickup, having plexiglass barriers, enforcing social distancing, storing patient payment information, limiting in-store capacity, and refusing to handle patient bottles for refills. Of mandated pharmacy protocols that respondents listed, the majority of pharmacists did require face coverings of both staff and patients. For willingness to participate in outbreak efforts, respondents were asked if they have a formal plan or agreement in place with local health departments like South Carolina DHEC regarding the pandemic, to which 29% of pharmacies said they did. These agreements include details for COVID vaccine distribution and administration, ensuring that pharmacies have prescription medications in stock, obtaining PPE, and screening patients for COVID-19. And to assess the secondary objective, pharmacist pandemic preparedness training and experience were assessed by a series of yes or no questions. It was shown that about 3% of pharmacists reported having participated in pandemic preparedness exercises prior to COVID-19. More than half of the respondents were practicing pharmacists during the H1N1 pandemic in 2009, but only 41% administered H1N1 vaccines. Of those who did administer, about 5% developed a pandemic preparedness plan after the pandemic. Some strengths of this study were that it identified areas of weakness regarding pandemic preparedness. It utilized qualitative and quantitative data analysis, and we tried to limit non-response bias by having the incentive of the Amazon gift cards and having follow-up with the participants via reminder postcards and phone calls. Some limitations include the small sample size, limited generalizability, social desirability bias, utilizing only PICs as the survey respondents, and having inaccurate addresses or pharmacist contact information from the master list. So pandemic preparedness plans and formal training are definitely limited among community pharmacies in South Carolina, but pharmacists' willingness to participate in outbreak efforts is noted by pharmacy protocols in place both to protect staff and patients and by the creation of those formalized plans and agreements with local health departments in preparation for COVID-19 vaccines. Pandemic preparedness plans may increase readiness and ability to combat pandemic situations, but further studies are needed to assess their impact. For our self-assessment question, what is one way that community pharmacists can improve their response during a pandemic situation? A, stop all pharmacy workflow, B, create a pandemic preparedness plan, or C, do not partner with public health. The answer is B. I just want to thank all of my co-investigators and my residency program director for their help throughout this project. Thank you all so much for taking time to watch my presentation.